we're going from ALL to AML. So we switched from the acute lymphocyte to the acute myelocyte, okay? Drastically different, okay, as far as the population goes. Who gets this one? Mostly older adults, right? If you look at this, around 65 years old, as in retirement age, okay? Predictably, what do you think the survival rate is for this?
Small.
Heck of a lot lower, right? Because now we're talking older, where at 65, you're pretty much, you're at the retirement age, beginning of the geriatric population, right? And of course, things don't tend to go as well with cancers at that age, okay? So, yes, predictably, the survival rate is a lot lower. This is one of those things where you see a lot more men with it, and especially men who have had jobs where they maybe worked with industrial cleaning solvents for many years or something like that. You guys have heard in your chemistry classes about benzene, right? What do you know about benzene? Anything? Huh? It's more stable? Yeah. Yeah.
It's just like the range structure, so it's easy to cause mutations.
Okay. It's a ring structure so it's easy to cause mutations in cancer.
Yes, because
And you got that from a chemistry class?
yes.
Okay. From OChem, see? They do teach you some useful stuff in OChem, right? Because that's what's happening, right? Is these benzene rings, they do mutate. Okay, so people working with like industrial solvents that have benzene in it, they're supposed to use these real thick rubber gloves and stuff like that. Back when I was in the Air Force, I kind of made the mistake of not using those big, stupid, heavy gloves when I was working with them once, and I accidentally poured the stuff that had benzene in it on my hand. You can actually feel it go right through. It just falls right through your hand and comes out the other side. It's bizarre how that just, maybe it is the rings. I don't know, but it just slips right through there. What the heck was that? Man, I'll put the gloves back on, right? Anyway, people that work with benzene, industrial cleaning solvents, that sort of thing over a long period of time, they are much more likely, and traditionally that's been men that did that, so they're much more likely to get this kind of cancer when they're at retirement age than anybody else. And yes, the survival rate is really, really low. Okay, but that's not the biggest thing. There's also chemotherapy or radiation, which means you think about your patient, you think about your case study, maybe it's somebody who's already had cancer before and had to get chemo and radiation, which also increases the chance of them getting this kind of cancer. By the way, as a side note, there's a weird statistical fact that anybody who's had any kind of cancer before, any kind, has like a 33% higher chance than the regular population to get another kind of cancer, or even the same one return. That's why if you looked at those slides about the survival rates, notice it doesn't say cure rate. It always says survival rate after 5 years. That's how we measure it. You're still alive after 5 years, and it's kind of gone away. You didn't see it anymore. We don't usually say it's cured, but we say you're at the 5-year survival rate, probably good, right? However, it does still increase the chance that you get another one of some kind somewhere in the future. Okay? Having said that, with ALL, a lot of physicians will actually talk about cure rate, just because, again, little kids are just ridiculously good at killing that off with chemo and radiation, of course. Okay? Now, the big thing with AML is actually going to be the hour rods. Okay? Hour rods. By the way, look at that whopping 27.4%, and that's now. I mean, it used to be like nobody lived. But, you know, now we're up to a little bit more than a quarter of people. Still not great, but, you know. So hour rods, if you are looking at that cell, you see these little rods in there, okay? If you see that, that's going to be big. So, yes, would I put something like that on the test? Absolutely. Because you can see that, okay? I'm not asking you to, you know, be pathologists or you know, be awesome in histology, but these are the kind of things that anybody should be able to look. Wow, can you see that? This thing has a brain inside of the cytoplasm. Can you see that? Little sticks in there. It looks like somebody's trying to build a house or something. Those are owl rods, right? That is unusual. You're not going to see that in other things. So that's your big, huge clue. If you see something like that, you're like, oh, that's an owl rod. Cool? Move on. That's got to be AML. Okay? Actually, I was going to go into that, but I decided not to because it's a little detailed. Okay, let's go into this case study, shall we? Dr. Grubbs has been an organic chemistry professor at Grand Canyon University for more than 30 years. He is 47 years old, you can do the math on that, and has become a bit clumsier than before. Every time there was a chemical spill, he never bothered to wear gloves. Recently, he's been feeling a bit fatigued, seems to be more prone to infections because he's been feeling a fever coming on. I didn't write this, so this is weird English, but whatever. He presents with night sweats as well. He also has been complaining of having bone pain and is not sure why, but he blames the fevers. We conducted a CBC, found that there were abnormally high amounts of white blood cells. Also conducted a bone marrow aspiration. Blood work came back with large amounts of blast cells containing owl rods. What is the diagnosis?
AML.
AML, right? Because you didn't have to read any of that. You saw owl rods and went AML. Right? What else do you know about this? What's the survival rate? Before Dr. Grubbs here? Yeah, like 27%. It's not good. How did he get it, probably? Maybe working with chemicals, right? He was a chemistry teacher. Yeah? That kind of thing. Benzene exposure. Did he have cancer before? Maybe. He may have had previous route of chemotherapy, radiation, that sort of thing. That could also increase it. Does it make sense? See how we kind of just throw that in there? And by the way, when you're reading case studies, whether it's in this class for tests or whether it's the MCAT, go to the question first and see if you can answer without reading the rest of it. It might make your life a lot simpler. I don't know if you've noticed that when we were going over those AAMC Khan Academy things. Most of the time, go to the question. You probably answer. You might have to go back to the passage, but why not at least make your life simple and not confuse yourself with all this detail if it's like, dude with owl rods. Oh, that's AML, right? And then you don't need the rest of it.
You should get case studies like that all the time.
We do.
You get all sorts of cases. I mean, I can put nursery rhymes on your exams just to prove the point of you're looking for buzzwords, you're looking for key phrases. That's what you're supposed to be looking for, even if I threw it in a nursery rhyme that I made up. The point is people are going to tell you this stuff in all sorts of weird ways. If you can learn to identify those buzzwords, that's all, man. The case study, and blah, 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 hour rods. Oh, good. Right? Cool? Okay. So let's go to chronic leukemia.